I'm Dr. Ramnath, and today I'll be discussing head and neck anatomy. We will begin our discussion discussing the neck, which is divided into an anterior compartment or visceral anterior or visceral compartment. It's composed of the hyaloid bone, the pharynx, the larynx, the esophagus, and other associating parts. So the second compartment is the posterior compartment, and it is also referred to as the vertebral compartment. It is composed primarily of muscles which are associated with the cervical vertebra, the ventral rami of the cervical plexus and brachial plexus. Both compartments are covered superficially by two muscles, which are called the sternocleidoid muscle and the trapezius muscle. The two muscles serve as dividing the neck into an anterior and posterior compartment. Okay. In this picture, you can see that the posterior compartment is composed of the trapezius muscle, and the anterior compartment is composed of the sternocleidomastoid muscle. As we said before, the posterior triangle is bounded by the sternocleidomastoid and the trapezius muscle. The floor of the posterior triangle is bounded by the anterior scalene, the middle scalene, the posterior scalene, the splenius capitis, and the levator scapulae muscle. The three trunks of the brachial plexus and the subclavian artery passes through the floor of the posterior triangle, which lies between the anterior and middle scalene, just under the clavicle before they enter the axilla. The accessory nerve innervates the sternocleidoid muscle and goes down to innervates the trapezius muscle. Any lesions to the accessory nerve will result in weakness or wasteness of that muscle. You would also have the inability to shrug your shoulders. The inability to innervate the sternocleidoid muscle will result in the inability to turn your head to the opposite side like this. Also in the posterior triangle is the phrenic nerve, formed from the ventral rami of the spinal segments C3, C4, and C5, which lies anterior to the anterior scalene muscle. The anterior triangle is bounded by the anterior border of the sternocleidoid muscle, the anterior midline, and the body of the mandible. Subdivisions of the anterior triangle contain the strap muscle, the mandibular gland, the common carotid, the internal carotid, and external carotid arteries. Also part of the cranial nerve 10 and 12. The strap muscles consist of a series of 5 pairs of muscles, which have attachments to bony or cartilaginous structures adjacent to the midline, beginning at the sternum and extending to the underside of the mandible. Strap muscle act on mandible, hyaloid bone, and thyroid cartilage. The ansa cervicalis is a loop formed by fibers C1, which is the superior root, which course inferiorly by hitchhiking with the fibers of the hypoglossal nerve to join fibers from C2 and C3, the inferior root. The fibers of the ansa are distributed to 3 strap muscles: sternohyaloid, both bellies of the omohyoid, and the sternothyroid. The thyrohyroid and the glenohyaloid are strap muscles innervated by C1 fibers. Carotid triangle. The carotid triangle is a subdivision of the anterior triangle. The carotid triangle contains the internal jugular vein, the vagus nerve, which is cranial nerve 10, and the common or internal and external carotid arteries. All of these structures are found in the carotid sheath. The most significant artery of the external carotid system is the middle meningeal artery. It arises from the maxillary artery in the intratemporal fossa and enters the skull through the foramen spinosum to supply the skull and dura. Lacerations of this vessel results in epidural hematoma. So basically, the most important vessel of the external carotid is the middle meningeal artery, which is a branch of the maxillary artery. Any rupture to this will cause epidural hematoma.